Now, in addition to case management, Isa can also review her dashboard. Here you can see a very high-level snapshot of her village. For the month of June, she has had 4 acute illnesses diagnosed. She has 6 pregnant women who are currently in antenatal care, no newborns, and she's case managing 5 people with acute illness, 1 child with malnutrition, and 5 pregnant women. She could also filter by a different village if she wanted to. These are only the villages that she has been assigned to. We'll stay with Karambo for now. Now she can go more deeply into the snapshot. Now she can go into antenatal care and see much more detail regarding the number of newly identified pregnancies in this month, those who are within 4 months of their due date, and those with danger signs. She can also see for the month of May. We can see the number of children who have good nutrition in her village, the number of children she's evaluated in the past several months. And we can see the percentage of children in her village with stunting, underweight, wasting, or acute malnutrition based on MUAC. And also the newly diagnosed cases of stunting, underweight, wasting, and MUAC. And all of this information is aggregated at each level. So while Isa can see this information for her village, health centers can see all of this information for all villages, and hospitals can see all information for all health centers in their catchment area. And for acute illness, you can see an overview of information, how many people have been assessed for acute illness in this month, the number of people that are being evaluated and managed in the community, the number of people who've been referred to the health center, the number of diagnoses that were not clear, and the number of fever of unknown origin. And then a breakdown here of the types of diagnoses related to fever. So if someone came in with a fever, 25% of them were identified as COVID-19 suspects, and the other 75% were malaria. If there's a fever of unknown origin, we would see that on this circular graph. Then you can dive more deeply into each section. COVID-19, number of malaria cases, uncomplicated managed by community health workers versus complicated and referred to the health center, or uncomplicated but referred to the health center due to pregnancy, and then gastroenteritis as well. We will usually have a section on respiratory infection, but because of COVID-19, anyone with respiratory acute illnesses are categorized at the community level as COVID-19 suspects, unless there is another explanation. And that is a very quick review of our dashboard and case management system.